Jody.
Hi, my name is Jody, and in December of 2020, I was diagnosed with pancreatic cancer, stage 1. I was lucky enough to have Dr. B and Dr. Tasani find me and accept me into their trials. They were wonderful with me for the whole year. As of November, when I finished my radiation, my scan came back pretty good. And we decided to maybe start some maintenance this January, which I didn't do that well with, so we decided to go back to like the daily pills. And I'm feeling great, and I was just blessed to find these people and have their care, and my sister, who has been amazing to me. Thank you.
Before I turn it over to Dr. Von Hoff, have we missed anybody? Well, I will turn the program over to Dr. Von Hoff.
Thank you. Actually, Roger, I think we'd be better off to stop right now. Well, welcome, everybody. It's very good to hear some Wisconsin accents since I was born in Oshkosh. And as a matter of fact, last night I met someone who was born in the same hospital, although it was a little later, Mercy Hospital, right on the shores of Lake Winnebago. So it's great to hear Wisconsin accents. And that leads me to say thank you, first of all, for everybody coming. You're an inspiration to all of us. And also that we are very lucky today to have some real experts. To tackle this disease, you really need different expertise. And we do have some incredibly different expertise at the table. So what I've asked each person to do is to get up and say, just a few minutes, maybe 2 or so, of what they're most excited about in the pancreas cancer research arena. And we've arranged them, because we thought we might be at the baseball park, and we will tonight, so we'll go around the diamond and hear from each person. The pitcher, who's down on the end, one of the pitchers, we have 2 pitchers tonight, we have a relief pitcher too, is Dr. Susan Tsai. She's one of the quietest investigators that we have. She is a world-class expert in early detection and familial pancreas cancer. She's going to say a word or two. And she's also an outstanding surgeon. Dr. Evans was pretty smart when he recruited her. I could go on and on about her being from MIT and being in engineering, I think, to begin with. And then saw the light and go to medicine, and she also was at Hopkins, and I think Doug grabbed her as fast as he could. Right? So Susan, you want to come up and say a few words where you think most promising? Dr. Susan Tsai.
Good morning, everyone. I have to say I got in by airplane this morning at 1 o'clock, and just hearing the testimonies from everyone this morning was just worth the trip. I could go back to Milwaukee right now and be very happy, so thank you for sharing your stories. So I'm very lucky to work with Dr. Von Hoff and Dr. Borzanski, obviously my boss, Dr. Evans, I have to say that. There's a couple areas of research that we're focused on. I think with Dr. Von Hoff, we're participating in liquid biopsy research, which is early detection using blood markers. So we have some very, I think, exciting work coming down the pike from there. And I think, as you know, there are some commercially available blood tests that are also, being explored for early detection. So as many of you said, it's challenging when you're just diagnosed with stage 4, but is there a way that we could have maybe diagnosed you in your routine screening with your colonoscopy and your mammography and everything else? And I think the other area that we're really interested in that's funded by the Sina Magwitz Foundation is exploring how we can better utilize molecular profiling and deliver precision medicine for patients. So that's another area of great interest. Thanks, everyone.
Thank you, Susan. Well, we were taught very early on that the best preparation for medical school was to have a PhD in mathematics, believe it or not, because we knew that those were the smartest people around. And we thought that we could really beat them in medical school because we were doing science and chemistry and biology. But soon, it took about 6 months or so when the mathematicians caught up with all of us with those backgrounds. And so we have a brand new person who's been recruited to the cause, Dr. Christian, Dr. Christian, I want to say Mirabelli all the time, sorry, Tomasetti. And Christian is a mathematician. Christian is very famous in early detection of cancer because he discovered things called the bad luck genes. People will tell you that, gee, you know, some familial, right, Susan? We got 10% or so familial. Some people will say environmental with smoking. But Dr. Tomasetti said, gee, you know, that doesn't really explain it. So I'm going to have him say in a word or two. And he also is following up on the fact that taller people have a higher incidence of cancer. We never really understood that, why taller people have a higher incidence of cancer. I was kind of glad I was short, frankly. I was kind of born that way. But I'm going to have Christian Tomasetti say a word or two about his work and the bad luck gene.
Thank you, Dan, and thank you, Roger. It's an honor to be here today. Before talking about me, I just want to say that I never been at an event like this with survivors, with this amount of survivors, especially in pancreatic cancer. And as Dan said, I'm a mathematician, so you definitely beat all the odds and are miracles and a blessing, really, to all of us. And I hope your voice can be heard as much as possible. We need it in science too. And you know, I want to say, of course, it's a miracle, but it's also, as you know better than me, a lot of fighting and faith. So thank you for what you are doing. In my research, as Dan mentioned, I discovered that a lot of cancer actually does not have anything to do with inherited bad genes or with exposures, but it's just simply bad luck. And so that discovery then brought me to really focus the great majority of my research on what you can do with that. Because, you know, if this was due to exposures, you avoid smoking, you avoid sun exposures, and you're okay. But if it's just bad luck, what can you do with that? And so the answer, in my opinion, or a very important piece of that answer is through early detection and finding cancer at stage 1, stage 2. And so the way to do that, we are working on two fronts. On one side is with a blood test. Essentially, you can envision just going to the doctor once a year and have a regular blood test. We have already published about this blood test. We are working always to improve it, of course. But the next stage for that is now to bring it to a very large scale. We are thinking to sequence basically for free initially, just give it to the general population, a whole city, maybe a whole state, to show how much of a difference in mortality that can make. And the other is to look at through imaging. As Dan mentioned, we know that taller people have higher risk of cancer just because of having more cells in our organs. Also, larger people have more cancer, and I'll have a picture later for those that are interested. I can show you. It's not just that we gain fat, it's also our organs literally get larger, and so again more cells. And so we do plan to do a lot of imaging to detect pancreatic cancer in that way, and we have again some very exciting techniques there that we would like to apply to the population. Thank you.
Dr. Tomasetti joined us just a few days ago, so we are so glad to have him. And remember, the big picture here is to have an effort so we detect everyone that has this bad luck gene and watch them more carefully and catch this disease in stage 1 or earlier. And we'll be speaking tonight a little bit about what you do if you had that bad luck gene. Right? Well, on first base, so thank you to the pitchers. We have a relief pitcher and the main pitcher, starting pitcher. And now we have first base. And we thought we'd arrange this as kind of what you think of first, right? And the first thing you'd think of is that, especially with catching it earlier, you think about surgery. So we're very glad. You've already heard a lot about Doug. But Dr. Doug Evans, to the podium, please.
Thanks, Dan. It's really a special privilege for me to be here. You know, I played first base in high school, and I was probably the worst baseball player. For some reason, the coach liked me. I can take my mask off for the microphone. For some reason, the coach liked me, and my only chance of getting on base was getting hit by a pitch. So I would always crowd the plate, and the best pitcher in the league was actually played on a summer basket. I was a basketball player, played on my summer basketball team. And he knew that when I got up, the only chance I could have, because he threw really hard, was to get hit. So I would basically be over the plate. And there were a couple times he charged the plate because, you know, he hit me, they gave me first base. Anyway, maybe I could start by introducing Gabby Piptuck and Natalie Lang, who are two of our great nurse practitioners. Stand up for 1 minute. Really great, yeah. So all of the patients who come to see Susan and myself, they know that really, you know, the key is to just get to Gabby and Natalie, and they'll take care of everything. I'll give you one quick story and two things, one of which you can help with. The quick story is, before the pandemic, I was asked to give a little talk at a fellows conference. So to do fellowship-trained pancreas surgery, it's 5 to 7 years of surgery training after medical school, and then 2 years of fellowship. And the fellows around the country get together once a year for an educational conference, and I gave a talk at the dinner on career development. It was kind of an average, probably boring talk. The person after me was just great. He was a psychologist, executive coach, talked about the power of positive thinking and how looking at every issue in your life, and especially at work, you can look upon it as either a catastrophe or as an opportunity. And if there are any Tom Brady fans and who have watched his ESPN episodes, the last episode may be kind of tied in with that. But this gets to one opportunity I think we have in medicine. And I'm really excited about the fact that there's renewed interest and excitement for doctors to work together. And despite healthcare consolidation, I think regardless of where a patient is diagnosed with pancreas cancer, they're now, and perhaps even enhanced by the pandemic, the ability to virtually get together. And I think that foundation is really becoming strong. And all of you and all of the patient advocates can continue to push to make sure that we all work together. And then secondly, and you'll notice I'm not talking about science because on the IQ scale on this podium, I'm keeping the bar average. I'm on the lower end of this. The other area that we have a big interest in, especially in Milwaukee, is ensuring that every patient with pancreas cancer has access to care. All of you in this room have people who love you, and that isn't true for everyone who's diagnosed with pancreas